So Brittany, we want to start by talking a little bit about your career in general. So you are a very young CEO. You are running this health system. Tell me a little bit about how you got here.
Yeah, that's a great question. So I started in healthcare coming out of college. My mom was a nurse and my sister's a nurse, so I felt inclined to go into healthcare, but not as a clinician. So I went the business route and started out in finance. I've worked around in different hospitals across the country, came to the DMC as a CFO and was here a couple of years, and honestly just really loved it. It's an amazing place. There's unique challenges, and got the opportunity to take the CEO position. It wasn't necessarily in my path that I was expecting this early, but I really enjoyed the challenge, and I'm really lucky that I have an incredible team around me. So
now you've been in this position for 1 year now?
About 2 years.
About 2 years, okay.
Well, 2.5. I started out interim in September of 21, took the position officially in February of 22, and I had my baby March of 22. So it's been a busy couple of years.
That's an understatement for sure. Yeah. So when you did take that position on 2 years ago, what did you notice were the challenges that you guys were up against that you wanted to, kind of fix or move around?
Great question. So 2022, we were still sort of in the midst of the pandemic, coming out of the pandemic. We had numerous challenges like health systems across the country. So really working on trying to stabilize staffing, stabilize operations, get patients comfortable again with coming into hospitals. So there was really a lot of issues that we had to tackle. So I'd say that first year and a half was really just working on stability and trying to stabilize those key areas. And then as we started to feel like we had things moving in the right direction, that's where we really shifted our focus to what are the things now that we need to do to improve in the community. And we did a survey with a local company to really get the voice of the community. And so we did that about a year ago and got some really good feedback from that. But the biggest point of feedback was around the emergency departments, and that really being the most important thing for this community and how they choose where they want to get health care.
I know that Tammy, before we got rolling, was telling us a little bit about some of the wait times pre-pandemic, and obviously you weren't here at that point, but can you just kind of tell us about the journey from the 29-minute wait that the hospital is known for to where we are today?
Yeah, so that is one thing. So I started just before in 2018, so I had some time before the pandemic, but I didn't realize at that point before the pandemic that the ER efficiency was truly a strength here at the DMC, and it wasn't until we did this survey that I saw the history and understood it. I had heard about the 29-minute campaign because everyone talked about it. So it piqued my interest for sure. And, we then started looking at, okay, where were we before the pandemic? We still have the same physician group that we had then, and tried to dissect it. What is it that has caused us to have the longer wait times? Obviously, like I talked about, the impacts from the pandemic were key. We just had to put the pieces back in place. So we were intentional about not just trying to repeat the 29-minute campaign because I thought we could be better than that. So the 29-minute campaign was largely the time that you walked in the door to when you saw a physician. I really wanted us to focus on the entire ER experience. Being a mom, I've unfortunately had ER encounters, and while I'm always happy to see a provider, it's that time after the provider to the time that you leave that you start to feel anxious or you really just want to be able to leave. And so I wanted it to be that end-to-end experience that we focused on. So where we are today, across the DMC, last month we averaged 21, we talk in terms of median time, so 21 minutes to see a doctor. So we're beating the 29-minute campaign from that perspective, but really trying to focus on that full experience.
Why was cutting down that wait time so important to you as someone who works in the medical field?
Yeah, it's a great question. So that survey that we did was really what pointed us in the direction of this is truly the number one matter that's important to our community on what we should focus on. So that was the basis for it. The thing that I love about this initiative is every hospital focuses and talks about ER wait times. So focusing on the ER was nothing new before we started this in September 22 or 23, sorry. But we shifted how we talked about it. And so we said, this is what our patients want and it's what they need. And so we put the patient at the center of it and said, this is what we're focused on. And we really started to see traction around it. So it really was just trying to work with the patient at the center of what we do.
Correct me if I'm wrong. You guys call this the Faster Initiative, right?
Yes.
Okay. What were the pieces that came together to cut down on that time? Was it hiring more staff? What does that look like?
It was a bunch of things. So we did a lot of observations to just see, like, I tried to look at it with our team as if you're a patient coming in the door, and where are the areas that you get held up. So, you know, registration time, how quickly can you get through registration? How do we minimize how much time we spend doing that activity versus getting you to a clinician? The time to triage, so getting you in front of a nurse so you could be triaged to see a physician. So some of it was definitely adding in staffing so that we could speed up the process. But it was also things like how quickly we got labs to the lab so that they could run those. You know, sometimes things get batched, and so instead of batching, we really encouraged people to just send the labs down, and you know, we incorporated the lab. I spent time talking to them. I want you guys to tell us if you see batching. Mm-hmm. It's not that you're, you know, ratting anyone out, but that way we can keep an eye on all steps of the process to make sure we're continuing to push this initiative. Same thing with imaging time. So getting the imaging study done, but then getting the radiologists to read the study so that it can get back to the physicians and they can make a decision. So it truly was multiple areas that we focused on and many different disciplines that have been part of this initiative to make it happen.
Have you guys gotten feedback from any patients on their experiences since
Yes,
you've done the survey and
sure.
made those changes?
Yes, so we're seeing really great results from this. There's a few ways that I'm monitoring to see is it actually working. So one is just the internal pulse, right? So before we started this initiative, people were frustrated. Physicians were frustrated, staff were frustrated because they didn't want patients waiting as long as they were. And now that we've been doing this, you're hearing a lot more positive feedback on what they're seeing and what they're hearing from their patients. Patient experience scores, so we monitor those, and we're seeing patient experience improve across the DMC. So we're up like 15% over where we were this time last year and continue to see that improving. And then for me, the biggest point that we can look to on if it's working or not is, are more patients choosing us for their health care? And we're seeing each month as we continue to chip away minutes from the wait times here, we're seeing volume increase every single month. So that means the word's getting out. We haven't even started the marketing initiative, but when things go well, I think the word spreads, and when they don't go well, the word definitely spreads. Mm-hmm. So we've got a few different ways that we're trying to keep a pulse on it and make sure that it's being felt by the community, and I think at this point it is.